Hello, my name is Mario Alonso Puig. I'm from Spain. I'm 56 years old. And by profession, I'm a general surgeon. Many years ago, when I entered into the medical school, I read a book about the power of communication to influence our health, our vitality, and our level of energy. Since nobody at the medical school taught me that, I decided to study it by myself. I studied different fields of philosophy, psychology, neurosciences, and after I got my training in general surgery, I also got different trainings in different fields of science and philosophy. And then I started to apply this knowledge, this understanding to my own patients as a surgeon. And they told me, Mario, Dr. Alonso, why don't you take this methodology, this technology to a broader audience so that we patients benefit from it, and also people who are not sick would also benefit from it. So I started to give different lectures and different workshops, and I started 17 years ago. Part of my practice was a surgical practice, and part of my practice was lecturing. I reached a point in my life around 9 years ago, where I couldn't share both activities at the same time because both of them were very demanding. As a surgeon, I had to perform a lot of surgical procedures, and also as a lecturer, I was invited by different universities and different places around the world. So I made quite a difficult decision. I decided that I would devote the rest of my life to sharing this understanding of how the mind, how the brain, how our body are connected. Why? Because I think that if we really knew some things about the working of our minds, the importance of consciousness at the time of showing us new pathways to be happier and to contribute more to society, I could also be working as a doctor, maybe not using my surgical instruments, but using my words. So what I would like to share with you today is the importance of trust and the importance of generosity, not only in the surgical field because it has an outstanding role, but also in other aspects of reality. When you work in a company, when you are with your family, with your friends. So I'm really delighted being with all of you today. I'm delighted that you share with other people this material so that you can help other people to be more effective as human beings, and above all, to be happier. The first thing that I would like to share is the following aspect of the relationship between a surgeon and his patient. When two human beings really encounter, really meet, really create an emotional bond, something extraordinary starts to happen. It was discovered 6 centuries before Jesus Christ was born by some Greek physicians. They discovered that when we truly care about a patient, when this patient really feels understood, something great is set in motion. At that time, they didn't know what was that. They didn't know what kind of energy was that. Now we know that is the immunological system. When we create that emotional bond, the immune system, the leukocytes, the lymphocytes start to work in a different fashion. As a result, our wounds heal faster. We get rid of infections faster. And this is one of the main reasons why we physicians, no matter if we are using a knife or if we are using a word, really value the importance of this emotional bonding. What is the importance of trust? There are two kinds of trust between a patient and a surgeon. When a patient goes to see a surgeon because that patient has a kind of ailment, a kind of disease, he or she expects to meet somebody who has truly technical expertise. So this patient is looking for somebody who really is able to make an adequate diagnosis and to apply the correct treatment. So that makes you trustworthy. But that's not enough. There is another aspect of trust which is essential at the time of creating that emotional bonding. It's a trust that is created when a patient feels that you as a surgeon truly care about his feelings and his needs. This is a much more humane aspect of the relationship. It's not the technical aspect, how good you are technically. It's about how approachable you are, how tender you are, how understanding you are. And we know that when a patient feels this kind of emotional connection, because that patient feels understood, that person has a blood pressure which is lower. That's very important at the time of having a surgical procedure. We don't want a patient to have a high blood pressure because the chances of bleeding goes up. That patient also, in some way, sends an inner message, a molecule, a neurotransmitter, which makes the lymphocytes and the leukocytes work, as I explained before, in a different fashion. So this is the key of trust. What happens that many times when we go through our medical studies, they put all the emphasis in how good you are as a technician, how good you are at the time of making a good diagnosis and applying an adequate treatment. And they don't pay much attention of how expert you are at the time of creating that emotional bond. There is a science called psychoneuroimmunobiology, who has been developed for the last 40 years, which has shown very precisely the impact of our emotions in the working of our body. So this is an essential element. And I will give you a brief example. When you go to the room of the patient before he's sent to the operating room, when you spend 3-4 minutes with the patient and his family, when you go with the patient to the OR, when you change your clothes and you put the kind of gown that we need in order to perform the operation, and you just touch the patient's hand and tell him or her everything is going fine. We're going to solve the problem. You just relax, and you will see that when you wake up, you will feel that everything went fine. When you do that, the patient, even being unconscious, because the patient will be intubated by the anesthesiologist, even being unconscious, the body reacts completely different. That if you don't do that, and the patient goes straight from his or her room to the operating room and just meets the anesthesiologist and feels this kind of fear because he feels in a completely different context, surrounded by a lot of machines and noises. So this is absolutely essential. And also, when the patient starts to wake up after the surgical procedure and you utter some words, everything went fine, Mr. Jones, everything went fine. We are taking you to the intensive care unit, or we are taking you to the recovery room, and after a while we will take you to your room. Just those little words, those expressions have a true impact in how the physiology of this person responds. So this is why it is so important to create that emotional bonding. But this is something that could be applied not only in the surgical field, everywhere, in your family, with your companions, at work, with your clients, because we live in a paradigm of fear and we need to shift into a paradigm of trust. This is the reason why trust is so important. You know, we are in a world of complexity and uncertainty, and what we need the most at the time of dealing with complexity and uncertainty is a deep sense that we truly have resources, energies, talents, and capacities that could be awakened. This is the reason why creating an atmosphere of trust, when you convey with your own way of being, you can do it. We can do it. We are together. We will succeed in this world of complexity and uncertainty. We know not only that our immunological system starts to work in a different way, we also know that there's a change in the blood flow in the brain. At the time of dealing with complexity and uncertainty, we need to have a certain part of our brain especially active. That part is called the prefrontal brain. The prefrontal brain is crucial at the time of analyzing with precision, making good decisions, at the time of being creative, at the time of learning fast. It has been shown using very sophisticated neuroimaging techniques that when we convey that sense of trust, that sense of confidence, of faith that we can overcome any challenge, any obstacles, it has been shown that there's a shift in the blood flow inside the brain. And this prefrontal cortex, which is so important at the time of dealing with complexity and change, starts to receive more blood, which means that the neurons work better because they get more glucose and more oxygen. It has been also shown that when we really create that sense of trust, when we deal with uncertainty and change, there's an increase in neuroplasticity, which means that the neurons start to connect in a different way. There are more connections which are created just by this kind of emotional situation, that kind of confidence, that kind of trust, that kind of faith. And it has been shown also that there's an increase in the migration of stem cells from the cavities of the brain into some other structures. The main is called the hippocampus. So these stem cells move from the cavities of the brain into the hippocampus, and then they start to transform into neurons. Those neurons, those new neurons are essential at the time of controlling our fear and at the time of learning fast. So this is the reason why trust is so crucial at the time of dealing with complexity and change. What happens that when we surgeons are speaking with our patients are going into a world of complexity and uncertainty, and they know it. This is the reason why it's so essential that we really create that emotional bond, so that when the patient goes into the operating room, that patient knows perfectly that he's in good hands, not only in hands that are technically expert, but also in hands that will really care as a human being. So, in summary, I would say that if we do not create an atmosphere of trust, we will not have the opportunity of witnessing something which is truly magical. Many years ago, in an intensive care unit for children in New York, they discovered something surprising. There were a group of children who were recovering much faster than the other group of children, and they didn't know why. At that time, it was forbidden that the nurses touch those infants because they thought that if they touch those infants, they would get sick. So they use different procedures. They use special gloves, and they try to minimize the number of times that they touch those infants. But this group of specific children were recovering much faster, and they didn't know why until they discover a nurse was not following the rules. A nurse was touching with tenderness and love these little children. We now know that when we touch physically with that sense of love and with this tenderness another human being, there is a release of a very powerful hormone called oxytocin. Oxytocin is essential at the time of controlling fear, and is essential in the process of recovering a lot of our functions. So what this woman was doing at a human point of view, from a human point of view, was creating that human connection between those little infants surrounded by machinery and another human being. And that has also a repercussion. That also had an impact in the physiology of those children. Those children were releasing a hormone which was a response to that love. This is the reason why oxytocin is called the hormone of love, because whenever you create that emotional bond, no matter if you're a child or an adult, you release oxytocin. So human touch, when that touch is created by love, when the intention is showing your love, showing your care, has really a very powerful impact. And we know that that impact takes place even if the patient is unconscious. Because consciousness is something so big. Consciousness is not an enigma. Consciousness is a mystery. We as scientists could give some clues about how consciousness works, and we will try to solve that enigma, the enigma of consciousness. But from my point of view, consciousness is much more than an enigma. Consciousness is a mystery. So when we think that because a patient is under anesthesia, the whole world of consciousness is asleep, we think we make a mistake. A part of that consciousness is asleep, and that's the reason why the patient is not responding when we speak to him or to her. But there is another level of consciousness, a level of consciousness which is absolutely open to love, which is receiving those signals of love and touching with gentleness, care, and love another human being, has a response in that other level of consciousness. So I think that we as scientists need to fill our hearts with a sense of humility. We need to be humble in front of all mysteries. And human beings, we are not enigmas that science will solve. We are mysteries. And Albert Einstein said that we approach a mystery. It's important that we approach this mystery with a sense of awe, with a sense of fascination, and also with humility.